Hi, everyone. Glad to be here. My name's Melissa, and thank you for being here to let me share my practicum experience working with the Okanagan Nation Alliance. I am a grateful visitor to the unceded and traditional territories of the Silks, the Sinix, and the Shwepnik peoples. I gratefully acknowledge that I've resided in the West Kootenays for most of my life. I'm honored and privileged to be able to raise my children here, to call these lands my home. The Okanagan Nation Alliance is the tribal council for the Silks Okanagan Nation. The ONA's mandate is to advance, assert, support, and preserve the Silks Okanagan Nation title and rights. My practicum placement was situated within the Wellness Department, one of 5 distinct entities within the organization. The mission statement clearly identifies the actions and goals taken through this department. Reclaiming and restoring Silk's ways of being and knowing through the development of holistic wellness programs and services grounded in a Silks-centered framework. My practicum roles supported the strategic planning of the ONA Wellness Committee through research for the Silks cancer strategy. I took special care in reviewing projects, programs, and planning within each community and the nation as a whole. Silk's traditional teachings, beliefs, knowledge, values, and community-driven research was central to illuminating the current context for Silks Nation individuals, families, and communities. Understanding other communities and nations have been activating change and facilitating wellness was a central component to my practicum placement, and essential to begin to comprehend the cancer care continuum from a Silks perspective. I conducted a rapid environmental scan and literature review, including current practices within the cancer care continuum and the complexities of primary care transformation. Evaluation of evidence included privileging culturally informed ways of knowing, such as the lived experience of people, families, and communities, alongside cultural and traditional knowledge is currently practiced throughout the nation. I created an Excel matrix to compile relevant literature I'd reviewed, alongside research and data pertinent to the provision of cancer care, and in support of equitable and holistic wellness throughout the life course. There are many values of the School of Public Health and Social Policy that supported my practicum placement. Indigenous knowledge and the right to self-determination, diversity and cultural safety, and critical analysis drawing on principles of social justice and equity were the few that I highlighted here. I strive to always consider my own positionality and situatedness within the world by reflecting on my own social position as a settler to these lands, while honoring and respecting multiple ways of knowing regarding any given situation. I paid particular attention to my own biases and assumptions while trying to explicitly recognize them, so they would not unconsciously be reflected in what I chose to highlight within my work. Some of the public health and social policy skills that I utilized through my placement were cultural safety and competence, qualitative and quantitative research methods or research literacy, and critical appraisal of health information. I gave a critical eye to research design, protocols, and methodologies, and privilege community-led and participatory research whenever possible. I valued research that seek to identify community and systems level approaches in addressing inequity among population groups. The truth and reconciliation calls to action that resonated with me was number 43. We call upon the federal, provincial, territorial, and municipal governments to fully adopt and implement the United Nations Declaration of the Rights of Indigenous Peoples as a framework for reconciliation. And I've just listed some of my calls to action here. And how am I for time?
Your time's actually up, Melissa.
Okay, great.
So yeah, perfect timing.
Perfect. Thanks, everyone.